First of all, I'd like to thank you all for coming. Most of you know me, and that's why you're here, and I appreciate that you came. I'm honoured that you took time out of your Wednesday night to come listen to news about my new venture. For those of you who don't know me, I saw a few unfamiliar faces. My name is Dr. Rhoda Ryan. I'm a practicing family physician in Western Springs for the last 8 years. I'm from Ireland originally, went to medical school there, and ended up moving over here and doing residency at LaGrange Hospital. So I've been in this area since 2005 is when I started working around here. And so I made this decision to start a new practice this year called Direct Primary Care Practice. And so I'm going to tell you a little bit about it tonight. I just wanted to tell you, some of you might have looked at the website and seen this picture, and it has some symbolism for me, for my history. And this is a bridge in Ireland called Cara Direct Care, and it's set on the north coast of Ireland, which is close to where I'm from. I'm about 20 miles from there. But I thought it was symbolic because it's taking a step into the unknown. It's a very small island that you can walk across on a road bridge to. It's a tourist attraction there. And it's also very close to a town where my great uncle was the family doctor in the early 1900s. And he was really, the stories about how he was the doctor in the area, rode his bike around, went to do house calls, delivered babies, rode his boat to another island to take care of the people there. My dad used to tell me these stories. I'm actually the first doctor in my family since him, and he died in the 50s. So that's why I put this on the website. It meant something to me. So I'm going to get started here. So, direct primary care is not something I made up. It has been around for 10, 15 years now. I think I'm going to be there's about 1,500 practices now in the United States. About 5 years ago, there were only 700. So it's becoming much more popular among doctors and patients as kind of an answer to our healthcare problem. We all know our healthcare system is in crisis, and we see articles about it every day. The new healthcare bill, the Republicans and the Democrats are always arguing over what to do. So the three take-home points about direct primary care are: it increases your accessibility to your physician, it's affordable, and it saves time for both the patient and the physician. So I'm going to kind of go into detail about that during the presentation. This is a picture that I borrowed from another doctor who's direct primary care, and it was painted by one of his patients while he was working in his old private practice. This 10-year-old girl painted this picture for him, and she's sitting on the bed waiting to be examined. Her mother's sitting there with a book, and her doctor is sitting with his back to the patient and her mother at his computer. So most of you have been in my office. You've seen me with my laptop. I'm trying to get the stuff done in our 15-minute visit. I usually don't get more than 50% of what I have to get done, so I take it home and work on it at night time. And most of the criteria I have to follow is coming from insurance regulations and government regulations. So what I'm trying to achieve is trying to take it back and get rid of a lot of that and just be between myself and yourselves, so doctor and the patient, face-to-face conversation, longer visits. So what is direct primary care? Comprehensive care that focuses on the patient. Your primary care doctor can take care of 85 to 90% of your healthcare needs. We are trained, I've had a lot of training, a lot of years experience in all fields. There are obviously specialist procedures, etc. I do not do, but I am taught in medical school and then in family practice residency to have a comprehensive education in all aspects of medicine. So the primary care, we can do most of what you need on a year-to-year basis for your health care. So first of all, direct primary care involves a flat monthly fee, which you pay a membership, and that usually is by credit card, and we just set up a membership. It's month to month, you don't have to sign a contract for 12 months at a time. You don't like it, you can leave after 30 days notice. And most people generally find that it's affordable. It's usually, you'll see the pricing now, but it's between $25 and $100 per person per month. Improved access, I am going to have be available 24/7 for my patients. You'll be able to text me, email me, and if it's urgent, you call me. I'll have my phone by my bed at all times. I want to hear from my patients before they go to the ER, because I'm trying to save you going to the ER and paying the money that an ER visit will cost. Sorry, I'm going to have to stand back here. Let's see. Okay. Because I am, because I'm going to be able, the model helps me to see you for longer. Your visit will be at least 30 minutes, if not 60. If you need an hour and 15 minutes because you've got a lot of stuff going on, we budget for that. I will not have as many patients on my panel. I will not need to see as many patients per day because my administration costs will be a lot lower. So I will be able to spend more time with you, get to know what's going on with your health and with your life, because a lot of the time, I mean, most of you guys know I'm pretty social. I like to know what's going on with your families, and yes, you're all giggling. I know we have a chat usually, and then I end up running behind, and that's not fun for the people coming behind you. But that's part that I'm really excited about, is to be able to sit down with my patients and talk to them and find out what's really going on. Minimal to no wait times. We just touched on that. I tend to talk a lot in my visits. I enjoy hearing what's going on in my patients' lives, and then with my paperwork, I end up running behind. So I'm sure the vast majority of you have waited in my office to see me, if not 30 minutes, sometimes 60 minutes, which is really not acceptable. It doesn't make me feel good. It stresses me out, and I know everybody has a life to live, and they want to get out of my office. As I touched on, I want to hear from you if you're sick. I want to be able to try and prevent you going to urgent care and ER and incurring bills that are hundreds or thousands of dollars. And one part that I'm excited about too is that we will, if you need a skin biopsy, that'll be part of your membership. You need a pap smear, we do pap smear, it's all included. Very few of the procedures that I do, and I think I didn't go put them on the slides, but they're on your sheet, really what procedures that I will be doing in the office. Those are all included in your membership, okay? And I'm pretty excited to be able to provide that care. Because the vast majority of you know, when you go to a specialist, you get a procedure done, you have no idea how much you're going to get billed. No clue. And this is a concept called pricing transparency, which is part of this model. You know up front from my website, okay, well, this more complicated procedure costs me $20, but the rest of it's free. Not free, but included in the membership. And so no co-pays, no visit fees. You need to see me 4 times in a month. You come in 4 times in a month and you pay the same membership. So some of you have asked me, is this concierge medicine? And this is not concierge medicine. It's pretty similar in the access to your doctor, the length of your visits, and the availability and the membership fees. That's kind of where the similarity ends. Concierge doctors usually charge 2 to 3 times a monthly fee that direct primary care does, and many of them bill your insurance on top of that. So it really prices the majority of people out of the concierge market. And I remember looking at concierge medicine a few years ago and thinking that would be really nice to spend more time with my patients, but I knew I'd lose most of my patients except those who are well off enough to be able to afford this kind of model. So, as I said, I can't wait to not be staring at the screen and really actually looking in your eyes and talking to you and figuring out what exactly is going on, and maybe not missing some of the non-verbal cues that when you come in, and that I'll be able to get to the bottom of what's going on. So, I thought this was a pretty clever cartoon. It basically shows you the bureaucracy of how insurance companies are involved in every aspect of your care when we use your insurance for your health care. So many times, I'm sure some of you have had medication sent to the pharmacy by me, and then they don't cover it, so we have to go do a prior authorization, or we need a referral for a specialist, and then we end up doing a lot of admin work behind the scenes, and our staff members. We need more staff for that kind of level of care, because it takes a lot of phone calls, and a lot of faxing, and a lot of form filling, and all this sort of stuff. So that's where we're cutting out some of the stuff. This is really about the waiting. Actually, there's nothing wrong with me, but by the time I see the doctor, there probably will be. So hopefully that won't be the case. So this is just a slide. I want you to think about this when you go home. I'm not going to ask anybody to put their hand up and answer this. But what is your idea of your ideal health care? So how do you want your doctor to take care of you? Are you happy with how everything has been so far? I'm sure there's always frustrations, and there are definitely more frustrations when you have to wait for your visits, or wait to get in to see a doctor, or pay a copay every time, or not know exactly how much you're going to get in your bill. So that's just a thought-provoking. I want you, and I'm actually, if you have any ideas or you want to share with me, I'd love to hear from you. Send me an email. This is the kind of practice I'd like to see you set up. I can't promise I'm going to follow everything that everybody says, but I'd like it to work for both doctor and patient. I actually have with the freedom to set up whatever kind of practice I want to do. So as long as it works for me and I think it's a good idea what you're suggesting, I'm willing to give it a try, okay? So this is just another example that's used in direct primary care. We use our car insurance really primarily for catastrophic coverage, right? You have a car accident, you call on your car insurance. We don't use it for the day-to-day maintenance, for oil change or tire change, and we don't use it to fill our gas. In fact, like most of you, I'm sure, like me, kind of look at the gas prices in your area and try and figure out which station to go to that saves some money. My favorite is Costco, but we don't get there that often, so there's two, right by us, and they're 20 cents different, so I tend to go to the cheaper one. But can you imagine if your car insurance told you, no, you can't go to that gas station, you have to fill up at this one. So that's what your healthcare insurance is really doing, is they're becoming more and more stringent on how you use your health insurance, where you see your doctor, which doctors are on your plan. They're kind of telling you that they're in charge. So in primary care, we don't really need to do that. I don't expect you to be able to read this, but I'd like you just to look at the colors. And so blue is provider, so that's me. Patient is yellow, and that's you. And this is admin. And so this is just a general what happens when somebody gets sick. So at the start, somebody comes in with a fever and a cough. That's the yellow. They schedule an appointment. They can't get in. They wait to see. Then they come in. They deal with the office staff. They pay their copay. Come to see me. We give them. We either give them a prescription. They go to the pharmacy. Pharmacy has to go run through their insurance. Then they have to figure out what to pay. Then it gets approved. Sometimes it gets denied, and they recover. But if they're sicker, they might need an X-ray. They might need some labs. So they end up. Some of you have probably gone to the hospital, got your X-ray done after you've seen me. You have to go to the hospital, you have to see you go through the administrative staff there. They bill your insurance. Insurance tells them, no, we won't cover this much, we'll cover this much, and they send you a bill. And that's the same for the lab. And so you end up with bills 3 weeks, 4 weeks, sometimes 8 weeks later for these things that happen. And that's the amount of steps that we need administrative staff for. Now, with direct primary care, you call, text, email, and probably call or email for an appointment. You schedule it, you get in pretty quickly, you come see me, we do the lab there, we get an X-ray, and you know exactly how much you're paying for it, you pay up front, and then I dispense the medication, or if you want, depending on your insurance, if you want to go to the pharmacy, you pay cash and you recover. all that extra stuff is taken out of the equation. So, cost, let's talk about cost. So, direct primary care can work for most people to decrease your healthcare costs, okay? This is just a slide. It shows the cost of going to the ER or urgent care for normal common conditions. So urinary tract infection, ER, $660, $112 for urgent care. Sinus infection, $600 to go to the ER for a sinus infection, $112 at urgent care. For sore throat, $500 ER, $94 at the urgent care. That's the kind of visits that after hours that you can call me, okay? A lot of these I don't even need to see you for because we don't have to bill insurance. And so a lot of the time you'll be able to call me or text me, we take care of it over the phone, you get your prescription, and you feel better. So time saving for both you and I, and money. Now, this is just a quick example of an ER visit. I know at least 3 of my kids have had stitches on their eyebrows. They always, the toddlers always fall. $2,000 in a Michigan hospital to see a child and get sutures. I can do them for free as part of your membership, okay? It will not cost any more. So in insurance-based primary care medications, I know we've talked to some patients about the costs of their medications and how much they have to pay, even with insurance. So I will be ordering and dispensing medications from my office through a wholesale company. And they will be pennies on the dollar from what you would pay for them out of pocket at Walgreens or CVS. So there's there's a bunch of different medications. I'm sure some of you are on some of these already. This is a retail in the hundreds for a lot of these medications. I'll mention $100. The GoodRx is a coupon that you can get that if you're not using insurance for your prescription, you can use that to decrease the price. But it's still $20, $50. This is the kind of pricing that I can get the majority of the common medications for. And I am working through, I know I talked to a couple of patients by email and different stuff. I'm working through, you know, I think we'll have to sit down with individual patients and go through the medication list and see how much we can save. For the most part, all these generic medications I can get them pretty cheap. And dispense them. If you need them, we order them, it's overnight. Pick them up at the office, or at some point we'll be mailing them out from our office too. Excuse me. This is just another list of medications and really how much we can save you, especially if you have a copay through your insurance for every prescription you get. Some of those copays are much more expensive than the actual cost of the medication. Walgreens takes a cut of it, and so does your insurance. So we will not be, there will be, I think, the standard to add on for direct primary care is 10% to cover your bottle and your sticker. So that's it. We're not going to be taking any extras. So it's kind of the same with labs. We can get labs at a lot less prices than Quest or LabCorp will bill you for them. Ironically, they will probably go and get processed at Quest, but because I contract with them, we can get significant savings. So your labs will be, for your yearly physical, will be included in your monthly membership. If you needed an extra lab here or there, this is kind of the pricing that we would be talking about. So this is the pricing for my practice. So the under 18, actually under 22, if you're a college student and a valid ID, is $35 a month if you're just a single patient from your family. But if you're your family is joining too, that is $25 with like a paying adult. Between 19 and 44, $50 per month. 45 to 64, $75 per month. 65 plus is $100 per month. Family, 2 adults, 2 children, $140 per month. $10 each additional child. And there is going to be an enrollment fee of $75 per member or family, but because I want my favorite patients to come join me, I'm going to waive that fee until after I start. So that will be kind of the standard enrollment fee after. So let's get to some of the savings. Many of you may have a low deductible plan and you pay a high premium and then you have a low deductible. So you're paying a high monthly fee and then you don't have so much out of pocket after that. But that high premium adds up. So your annual premium could be $10,000 and then you just have to pay we'll talk about deductibles later, but if you take a high deductible plan, you usually save money monthly, significantly in a lot of cases. And it depends on, obviously, if you're employed, what options you have. But almost all companies are offering high deductible plans now. This is the way that it is going because it's so expensive to provide healthcare insurance. Companies are pushing their employees towards high deductible plans. So then your premium drops significantly, and then your membership, that's if you're a couple between 19 and 44, so $50 per month per person is $1,200 for the two. And then, so the total annual cost of your membership plus your high deductible premium is half the price of what you would pay for the low deductible. Why is that important? How many 19 to 44-year-olds need a lot of care that other than primary care? 85 to 90% of patients of any age max out their deductible every year. Do not max out their deductible every year. That's the punchline. I got that one right. Only 5%, 10% of people actually max out their deductible every year. So you're paying too much money if you're paying for a low deductible plan. And you are, in general good health, or even with some health problems, some minor health problems, chronic health problems. If you're not in the hospital or having surgery, you generally don't need that amount of coverage, okay? So let's add the deductible there. So what I'm trying to show from this, so low deductible plan, you've already paid all this money, so you don't really pay too much for your deductible. And this is your monthly or your yearly, $11,000. If you have high deductible plan with a deductible of $4,000, and we just put this in here because, as I said, 85–90% of people don't actually max out their deductible. Let's say you paid $2,000 out of your $4,000 deductible, and your membership, you're still saving money. But this is an important number here because this is the number that I believe direct primary care can help you save. I can't keep everybody out of the hospital all the time, but by providing unlimited visits and access to care, patients are much more likely to seek preventive care. And by keeping you healthy, we keep you out of the hospital. It's actually been shown that direct primary care patients do not get hospitalized as much, do not end up in urgent care, and are generally more healthy than patients in regular practices. So this is, even though I threw this in here just to show you, most of the time we can try to save you an ER visit, etc., and keep you healthier. Okay, so let's talk about a family with 2 kids. Again, we can go through this a little more quickly. We can get the gist. Low deductible, $13,000 just for the premium. High deductible, $8,000. You add your DPC membership, that's another $1,700. And not quite as much significant savings here, but you're still saving $2,800, which is a good chunk of change. And then, again, we just put in this arbitrary $2,000 for the deductible. And you can see that you're still saving money even if you have to dip in once or twice. But what do kids end up needing visits for? Stitches, colds, strep, rashes. Generally they don't get so sick where we can't take care of them in the primary care office if you have that access. This one is just to show you, okay, what happens, how do we make these equal so that you're not really saving anything? How much of your deductible do you actually have to payout. And this is like an arbitrary, okay, we really ended up, we end up being admitted to the hospital, something like that. So it would be $7,000. And obviously, you end up, with a high deductible plan, you end up getting admitted to the hospital. You might, that year, not save any money by using direct primary care. Might. But that's where the other benefits of direct primary care are still valid. The access to care, your doctor taking care of you, and the time saved by not having to go in for every visit, by being able to text or email, I need my refills, and not having to for it. So those are those intangible benefits that are not cost related are still there. Sorry, I'm just going to take a little glass of water. So I'm just going to go through a few questions. First of all, question answers, and then I'm going to open it up to the floor, because I'm sure some of you have questions, if not all of you. And so I'm going to go through a few of the ones that and some of you I've actually seen since I made this decision. You might have had some of these answers. Do I still need insurance? Yes. Well, you don't need an insurance to become a member of my practice. This is not insurance. This is not replacing insurance. You should still always have a catastrophic health insurance plan for eventualities like car accident, gallbladder surgery, ICU for meningitis, whatever it might be, okay? And specialist visits and that sort of stuff. Excuse me. I have insurance, why should I join you? Well, you may have insurance, and coverage does not always mean access to good care. Now I hope that, I'm sure most of you are my patients, so I hope I've been, doing a decent job at providing here. I feel like I can do a better job with this model. I know you all know that I'm part-time Tuesday, Thursdays currently, and this way I'm going to be probably working 3 days a week in the office, and then 2 days urgent calls and stuff only. So I'm going to be available more than I was before. You won't have to go through the office staff, wait for a call back, or wait for 5 days for your results, etc., etc. Then more preventive care we touched on just a few minutes ago. Access to the discounts that I can contract for. And we talked about the deductible and how you can save significant amounts by choosing a higher deductible plan. What about Medicare? So Medicare is usually the most confusing stage of your life. First of all, you definitely need good medical care, primary care when you're over 65. It's really important to have a good relationship with your doctor, because things start to sometimes go wrong. Maybe not quite 65, but they start. When you're getting old, you're more likely to get sick. So you do want a good doctor taking care of you that you can access, okay? I will not be taking Medicare, and I'll actually be opting out of Medicare to do this program. But I will still be able to see you. We just can't bill Medicare for my fees. If you wanted to bill your medications and your imaging and that sort of stuff through Medicare, that would be fine. It's just my membership fees that you can't get reimbursement for. Medicare patients will say, well, I have Medicare and a supplemental, and I pay nothing for my health insurance, I pay nothing for my medications and visits. You're always paying somewhere. So our job is to try to help you figure out, well, where can I save money on my supplement usually? We actually have an insurance salesman called Trey Williams, and his assistant Julianne here. He actually deals a lot with this. So I asked him to come. He's going to answer questions and talk about some of the options for supplements with Medicare, so that you can see where it might fit in with the DPC model, okay? Can I use my HSA or my FSA to pay for my membership? I say ask your accountant, because technically the legal answer currently right now is no. But it is in the current legislation. We're talking about this healthcare bill. It keeps getting pushed back. The Senate is fighting over it. They're going to vote on it after July 4th. I'm sure you've all been reading about the changes that are coming up. It is in that legislation and hopefully will be passed very soon and will go into effect very quickly after that. So I hope within 2017 you will be able to use your HSA or your FSA to pay for membership. And I've asked this question of some of the DPC docs in the other states that are doing this, and they usually say ask your accountant, can I use it? And a lot of accountants are saying, you know, you're small fish to fry, you're not going to get, a single person not going to get audited by the IRS, but you didn't hear that from me. I'm just saying ask your accountant because they may be able to tell you if it's worth doing straight away, but but it is, some patients have been known to be able to get it paid for by HSA, others, a couple have been stopped. So I think it probably varies on your plan. I believe FSA is currently, people can use their FSA for a membership, but I just have to make sure that that's true, because it's slightly different. You have a question?
But your insurance premium, you still can go through HSA, it's just the monthly fee you're talking about, is that correct?
The monthly fee cannot go through HSA, the monthly membership. Yet, it's coming. Can I get my membership reimbursed by insurance? Unfortunately, that's too tricky. It doesn't really work that way with DPC. Okay, so that's kind of the short answer to that. But all the other stuff, the extra stuff, can certainly be submitted. What happens when I'm on vacation? Am I allowed a vacation? Okay, so you all know I'm from Ireland, right? So every July we go to Ireland. My parents are getting older. They're 80 and 78. And so we like to spend time with them. And that's a trip that some of you probably know I take almost always in July. I'm not there. Dr. Flock has been covering, etc. I will have coverage. I still want to go see my parents once a year. And I will have coverage. I am going to be teaming up with other DPC doctors in the area, and there's only a few of us yet. There's one in the south suburbs, one in the north suburbs. There's another girl starting up in Schaumburg shortly after me. But I expect that within 5 years there's going to be 500% of us, because all the doctors that I know are so fed up with the insurance-based model, many of them want to leave. And in fact, there were times that I thought about leaving medicine altogether because it was so frustrating, but I didn't want to leave because I love what I do. So this, when I found the model, I was pretty excited. So yes, I will be taking vacations, but the beauty of it is, I mean, I could go out of town for a weekend and still be on the phone if I'm in the United States, and covering for the most part everything. But that, you know, there will be coverage. Okay, just because I'm starting by myself doesn't mean I will not be available for 2 weeks at a time. Okay. And I will have email blasts a couple of weeks before I go on vacation. Hey, if you need refills from this time to this time, get them in now so we can get them taken care of before I go. If you need to be seen for your blood pressure, come in before I go. So back to the 3 take-home points. Accessibility, affordability, and saving you and I time. And I'm very excited to be able to be the first DPC practice in the western suburbs. I've told some of you I feel like somewhat of a pioneer, even though I'm not American. I'm like a pioneer. But you know, it's very exciting to be able to offer this. I've had really good feedback from a lot of people. I know there's some people who are frustrated and saddened and confused, and I respect that. And I'm here to ask me. You can ask me questions. We can try to figure out if it will work for you. I hope that it will, and if it doesn't, I really have enjoyed being your doctor. I'm going to be around for questions after this, and also I'm going to be in the area, so if things change, and 2 years down the line you think, okay, you know, I really miss Dr. Brian and it's going to work for my insurance now, you'll know where to find me. I won't be far. So how do I sign up? You can email me at caradirectcare@gmail.com. You can go to the website. There's a button that says sign up, and it takes you through a whole registration process. I do urge you to do that as soon as you can so that your enrollment is finalized. You will not be billed until September 1st. If you are not comfortable with email or website or computers, give me your information today or call me on the number that we have here, and I will help you through the process. In fact, once I get back from Ireland, I'm going from the 2nd to the 22nd of July, I'll be happy to meet with you to figure out how to sign you up if you need to, or to meet you for questions, okay? So thank you very much again for coming, taking time out of your evening. I am almost close to really revealing my address, but I'll tell you it is really close to my old office. It's within a mile of my old office, so not far. You won't have an extra place to go. So again, thank you all for trusting me to be your doctor for so long. I appreciate your time. Thank you. So I'm going to open up the floor. I see. What's your name?
My husband, Jim.
Hi, Jim. It's very nice to meet you.
Good to see you too. So if despite your very best efforts, I ended up in the hospital, do you have privileges at the area hospital?
So I'm not going to be seeing patients in the hospital, taking care of them, because the hospitalists, I've contracted with the hospitalists to do that. For the same reason, I'm opting out of Medicare, I'm opting out of the insurances. The hospital has not recognized a DPC doctor as being good enough to bill independently of their insurance. They're all wrapped up in the insurance companies currently. I'm hoping at some point that's going to change. I've read about it, I've discussed it with other doctors in other states. Some of them, their hospitals are happy enough to let them do that, but it's not here yet. So I'm going to have to use the hospitalist, but the beauty of DPC is that I will be able to, I'll have more time, so I'll be able to come see you in the hospital. Even if I can't make those final decisions, I'll come see you, or you call me and let me know you're in, and I'll call the hospitalist. I'll have more time to be connected with your inpatient care. It just won't be billing you for it, okay? Yes, Mary Jo.
Are you going to, you are going to have an office where you?
I will, yes, and I actually think I found my office, but I haven't signed anything yet.
Okay.
So it's going to be very close. I'm going to have an office, yes, for sure. I think you were next. Okay, Karen, yeah.
I know you obviously didn't put a percentage down when you're talking about labs and things that are gonna get discounted because you're maybe not sure, but do you have an idea of how much
You
coverage?
mean how much discount
Yes.
you will get? Probably 80 to 90% on the labs and the medication. For most of them, yes, we can get those contracted. And the same, I didn't actually put up x-rays, but you know, you go to the hospital to get an MRI and you haven't met your deductible, you'll probably get charged 15 to 2,000. Has anyone had an MRI in the last couple of years? 1,500? Okay, well, I can get you a cash pay MRI at a local imaging center for $450. So that is going to be, I'm sorry?
Same quality of an MRI as
Absolutely. In fact, they're probably better machines. They have high quality radiologists and MRI scanners. I've actually talked to the imaging center, so.
I have one more question. You have
Colonoscopy?
You have
Colposcopy?
Yeah, what's
Colposcopy is a procedure that you have if you have an abnormal pap smear.
Oh.
So that's, usually I send patients to gynecology for that currently, but I'm actually, as part of my medical equipment, I'm getting a colposcopy machine, which I haven't done. I used to do them on the residency, so I'm excited to be able to offer that again.
He's a great son.
Yes,
How about mammograms?
so mammograms, I believe that they, a lot of the time, well, first of all, a lot of the time your insurance will cover mammograms fully.
Yeah.
So I would say make sure we use your insurance first, because you don't have to meet your deductible for that. The two imaging centers, I'm aware, I think one of them does mammograms. And if not, I'm planning to go out to some of these places and say, give me your best cash pay price. I'm going to contract, you know, if I can't get a price for mammograms in the hospital, I'll go somewhere else.
And how about if I have a heart attack and I'm gonna need to see a cardiologist?
So the cardiologist you would use your insurance for. But again, part of my lofty goal in the future, because I've talked to some specialists who are really fed up with insurance too. They're a little bit more locked in. It's a little harder for them to provide their care with the expensive procedures, etc. But I'm hoping that in the future, maybe not the first year, but maybe 5 to 10 years, a lot of these specialists will have what's called a DPC hybrid practice. So they'll have their insurance patients and their DPC patients who pay cash pay. There's actually, that's coming because doctors are all frustrated. They're getting, the insurances are squeezing them tight. There is a surgery center in Oklahoma that does cash pay surgeries that I've read a lot about. I've listened to the podcast. That you can get your knee done, you know, instead of $70,000 to the hospital, they do it all with your hotel next door, and a nurse comes to see you for like $15,000. Something, you know, it's a huge amount of savings if the doctors take it back and offer it without their insurance. This is all like it's like a snowball that's becoming an avalanche. So, and that's why I'm excited to be part of it, because I'm hoping that,
So
as you
if
said,
something is out of your realm, you would send us
Yes,
off to a
absolutely.
specialist,
I would.
and we use our insurance for
And you would
that.
use your insurance, or if a specialist is willing to, and you have a huge deductible, we would contract for cash pay visits.
Okay.
So I'd say, give me your best price for your visit, and this is what I want you to charge my patient. You'd pay up front, and then, you know, you wouldn't have to, you know, pay like $700, whatever it would be, okay? Because they can do it. Most of them are able to do it. I've actually talked to one of the local gastroenterologists about colonoscopies, about getting cash pay prices for colonoscopies that maybe aren't covered by your insurance. And it would be much less than what they would bill insurance, but they don't have to go through all the admin stuff. The sending the bills out to the insurance, sending it out to the patient. That cuts down their costs. So they're happy to offer cash pay. That's, once I get the practice up and running, I'm hoping to, you know, build a network like that. But not immediately, you'd use your insurance.
Okay, thanks.
Yes, Kathy?
Do you have any consideration to, in the future, maybe taking another physician in your practice that's also like you in a direct care, so that one kind is always there, like throughout the week?
You don't really want me to be your doctor?
No.
I got you.
But I mean, there are sometimes, like when you're
Absolutely, I would love to do that.
unexpected with your kids.
I would love to do that, and in fact, that's one of the reasons I'm hoping this office works out, because it would be big enough. The one I looked at before that fell through was kind of too small for 2 people,
Okay.
but this one is big, plenty big for 2
Yeah,
people.
space, okay.
Yes, so I would love to, and I would hope that things would, you know, I don't know when that would be, it'd probably be a couple of years.
No, but at least you
But
consider
absolutely,
that,
I
that
would
could be an
absolutely,
option that
because-
you would,
Yeah, for sure,
Foresee.
because it is nice to have
yeah,
a
backup.
part of backup. I mean, myself and Dr. Flock have done that for years, so
Yeah.
it's nice to have that extra person. But, you know, in the meantime, I have these other doctors in practices around the area who are willing to help out with coverage.
Even though they're not in this,
They wouldn't be, so say I was out of the country in Ireland for 2 weeks and you were not able to contact me directly, you would call them. And the vast majority of what you would need to do, need to get taken care of, could be done over the phone. If you needed stitches or something, you would have to travel to their office.
uh-huh.
Or decide to go to your urgent care next door, pay more money. That's basically how it would work. So you know, there would be the option to go to another DPC doctor's office and get taken care of, would be there, instead of going to the ER, okay? Yes?
And you're planning to have this up starting September 1,
Mhm.
to sign on with no initiation fee or
Exactly, yeah.
enrollment? Okay, because, so then in the middle of the year, I can't change.
Right, so I realize that there are people who cannot enroll, or it's not cost effective if they want to change their insurance plan. You let me know you're thinking of doing this, I will save a spot for you. So you come on whenever suits you. I'm still going to be nice to you, I'm not going to be upset that you didn't come in September. I'll always be happy to see you, even if it's 5 years from now. I understand that. I've had other patients say that to me. My enrollment doesn't switch over till November, and I'm paying this low deductible plan, high premium. I totally get it. And you know, there will be some people, they'll run these numbers and they'll work it out with their family, it might not work, and I get that too. I am just happy to be able to offer an alternative for many people. I had a patient say yesterday, I've always wondered why we didn't have a third option, a cash pay option. I'm really excited to, you know, have something new to try. So for sure, Diane, you can come on whenever.
Okay, thank you. And just another question about the specialists. In a situation where you have an ongoing need to see a specialist every 3 or 4 months.
Yes. So those kind of situations, many of my specialist referrals currently are because of a time crunch. I have a lot of resources, I have a lot of experience and know how to manage a lot of stuff, okay? I am hoping to be able to cut down on the amount of times you have to see your specialist per year. There is a service that a lot of other DPC docs are using. It's an online reference service where I can contact directly with the specialist but online and ask them how to manage somebody's problem. And so that increases my scope of what I can do for you in my office, rather than saying, oh my gosh, I've got 30 patients waiting, I don't have time to actually delve into this. I will also have more time in your appointments. So this, to me, it's a win-win, because you don't pay as many specialist visits per year, and I actually widen my scope. I become a better doctor. And I've always been somebody who doesn't refer as much as, you know, I feel like I enjoy learning about the stuff, the extra special stuff, but I don't always have the time. So that's one of the things that I'm excited to change.
Thank you.
Yes?
I have a couple questions. The first one, the membership fee that you pay, would it be able to go toward a deductible or would it not?
It would not go towards your deductible currently.
Okay. Is there do you have a list or a full list of the prescriptions that you would offer within?
Yes,
on the website?
I'm hoping to get it up on the website, yes, a full list, absolutely, so that you can compare. I'm actually logged into the wholesale company already. I started looking at it, but I haven't been able really to put it on the website yet, but that will be there as soon as I can get it up.
Related to that, if we choose to pay for a prescription that you offer within the direct primary care, if we choose to pay for that at the discounted price within, that would then not go toward a deductible.
You could submit that to your insurance. I would give you a receipt for that. You know, $4 or $5 or whatever it would be, instead of the 55 that you, or, you know, 30 that you would pay at the pharmacy. But you can submit that stuff, just not the membership.
Okay, and then for someone who does hit their deductibles, once the deductible is hit, would it then be free, or would it still?
Well, it depends on your plan, your insurance plan. I know our personal family plan, we had our deductible, we still have to pay 20% of our prescriptions. And that, for some of these prescriptions, may be more than what we can get through wholesale. I will also be able to access decreased prices for a lot of over-the-counter medications. So Tylenol, paracetamol, sorry, that's the Irish word for Tylenol. One example is Flonase. Flonase is $25 in Target. I should be able to get that for like $4 or $5. So there are a bunch of, we can go through what you get and take over the counter and order those too and save you money.
One last question, the enrollment fee, is that a one-time when you enroll a person, or is it annual?
So it's one-time fee, it's not annual. There will be, if you decide to leave, there will be a re-enrollment fee. So if you leave for, you know, after you say, I don't think this is working for me, I'm going to leave, but you won't come back, there will be a re-enrollment fee, but not, it's just a one-time fee. Okay. Yeah.
This young lady had an interesting question for me. So let's say there is a procedure in your office that goes, you charge a little more than your normal fee, so it's an extra $200. I could have that paid out of my HSA, or submit it, but would that normally go through I would submit it to Blue Cross first? And make sure they apply it to the deductible?
I missed the beginning of what you said.
So let's say you have a procedure, and you said some procedures you would charge a little more.
Okay, so I'm talking, say a knee injection with cortisone. The only reason I would charge more for that is if the medication I used for it was more expensive than a few bucks. Because I'm not gonna dig the nickel and dime people. Strep tests are gonna be free, people charge $25 for them, they're like $1 to get. So that kind of little stuff, I'm not gonna be charging for sutures and all that stuff. But if there's a procedure that's, a knee injection that says $20, because the lidocaine and the cortisone are, $15 or something like that. That's what I would charge for. There's going to be very few of those kind of procedures, really. But keep going with your question then.
So that in this case, we have an extra cost, and I'd like to apply whatever that is toward my deductible, right? So how do we submit this to the insurance carrier? Are you familiar with that?
I think I would probably have to give you a receipt for a procedure
Yeah.
done out of network provider.
I see.
I think that's how I would do it. And the same with the medications
Yeah.
and x-rays and stuff, you won't be getting them through my office, no, at least not initially, so you'll be getting a receipt from the imaging center and the Quest lab, you'll be getting a receipt from me. So you would just submit it as an out-of-network provider.
I see, okay.
I think there's forms in every insurance
Yep.
website for that stuff.
So then, those receipts that you were talking about, they could go through the flex plan, right?
Yes,
Because you
absolutely,
pay cash anyway.
no problem. And the FSA, I'll have to find out the flex savings, but it's probably included in this legislation that you can use flex plans for memberships too.
Right.
The only reason it's not in it, because it's obviously a medical service, is the direct primary care model is so new that the government wheels have not turned fast enough. So they're catching up. There's a lot of DPC doctors that are doing a lot, information and to telling senators about the model. They're all loving it. So, any more questions? Yeah.
A couple of things, if you don't mind.
Sure.
First of all, thank you. I think good luck on your journey.
Thank you very
I think it's
much.
a wonderful one, and I absolutely support the idea of trying to get this medical situation solved. And I think you really are going on the right track, and I mean that sincerely. I've done a lot of work in looking at concierge medicine for ourselves that we haven't embarked on, but we were very close. So the heart of the questions, though, you are on a journey, and a journey that I hope provides you and your family great success, but is there any guarantee as to how long you'll be in business? Because if this doesn't work, how does that affect everybody 6 months, a year, or 2 years down the line?
I will say that I'm really sure about this, and I'm not really somebody who jumps in with both feet. I'm kind of cautious. I had 4 kids in 6 years, so I was kind of busy for a long time. And I just kept working and kept taking care of my kids. My kids are a little older now. The youngest is starting full day school, and I've got a very intellectually curious brain, and I want to work. And I love my job, and I told you I was frustrated at times. I thought about leaving medicine, going to do something non-clinical, teaching or something like that. But the patients kept calling me back. I just enjoy the time I spend with my patients. And so when I found this model, I was like a light bulb went off in my head. I said, this is the answer. So I'm not going anywhere. I mean, unless my husband says, you're spending all our family money, keep us in afloat. But he's very supportive and he gets it too. And your reaction to, how wonderful it sounds, it's happening all over the country. I may be the first around here, but it's going to come, you're going to see more and more popping up very quickly. And I'm very proud to be able to offer a solution for a lot of people who are just bogged down by healthcare costs.
How does the children vaccinations for younger ones go?
So children vaccinations is one of the sticky parts of direct primary care. Generally I can't bill insurance for children vaccinations. So I have a couple of ideas of how to provide vaccinations. One is over 10 or 12 can get them at CVS. So we'll be able to get those, just the infants, etc. And then 2 is I actually have talked to an insurance-based clinic that she said she would provide them and that we could bill the insurance through her. So I'm still working on an ideal option, and again, I'm hoping legislation and stuff like that will there's actually a place I can order vaccines too, but I haven't put all the work into that yet. That's one of my next jobs in the summer. But I'm hoping that won't be a problem for long, that I'll be able to do them.
With a new business, what's your position on electronic records and patient access?
I'm all for it. I think you should all be able to see what's going on in your electronic records. And electronic medical records have been the bane of my life for years. But that's because I was trying to see a patient every 15 minutes and then make a note. I actually have signed up for an electronic medical record that is built for direct primary care. So it's very accessible. It's accessible from all platforms, iPads, phones. Patients will text me with an issue. I will text back or send in a prescription from my phone, and then I can click save and put it in their record from my phone. I've actually been with another DPC doc as she did that. I was like, oh, that's really cool. So they are the way of the future. They definitely help in a lot of ways, and I'm hoping with this model and this particular software, it helps keep things all in a good place.
And my last one, you said you had somebody there, I believe, on insurance because
Yes.
Marcia and I have been very blessed. We were able to retire early.
Yes.
We're paying our own full boat right now. It's costing us about $2,000 a month right now
Right.
for insurance. And certainly we can go to a catastrophic plan, but that's something I haven't really done any research with to find out
So,
what is
yes.
good and what isn't good.
Yes, Mr. Williams and I met a couple weeks ago and talked all through this. He's actually very excited for this model. He's saying he's going to, we're going to have a short break after the questions and please have some banana cookies. And then he's going to present for those of you who wish to stay and hear about self-funded plans. So if you're buying your own insurance, you're buying a Medicare supplement, or you just want to kind of learn more, he's going to have a presentation after this. So please feel free to stay, but I understand it's not going to apply to all of you if you've got employment insurance from your company, but you're welcome to stay. So.
And is Cara your company or is that a chain of some kind?
That's mine, yes. Cara, or Cara as I like to say. You can call it Cara if you want, I'm not going to call it against you. Cara is the Irish word for friend. And so, actually my mother speaks Irish fluently and she helped me pick this name. And I like this idea of, most of you, of course I'm your doctor first, but I'm that kind of person, I'm kind of a friendly person. So I like the idea of the personal care that where we become, a closer personal relationship with my patient. Yes.
You were just talking about electronic records.
Yeah.
So I was just wondering, let's say we might delay till next year, January to join because we're in some other program right now. Will you be able to get records
From Dr. Flock's office?
to tell us what vaccinations and
Yes.
shots and things like
Yes,
that?
that's a good point. I'm glad you asked that question, because I don't think I have addressed that at all. I have no problem getting those records, and I actually haven't figured it out yet, because it's another thing on my list to do. I believe I can transfer them directly from electronic record to electronic record. There doesn't even need to be print out, bring it over, scan it in.
Oh, okay.
So, but anyone who is following me from Dr. Flock's office does not need to sign for their records at Dr. Flock's office. I will be able to take those with me. We have an agreement, and we will bring your paper charts over to and just scan in what's needed, etc. But you don't have to worry about that. Yes.
Contraceptive care, is that included under women care, or do you have a plan to include it at all?
It's all included, yes. Contraceptives, birth control, everything.
So then those are free still?
Those would be, pennies on the dollar. It would be the wholesale prices, the contraceptive care, unless your insurance pays for them 100%. And that's maybe going to change in the next year. We don't know, because there's a lot of stuff. We don't know. We're not going to get into politics, but it might change. But if it does, it will be a little off from wholesale. So, any other questions? Oh, yes.
How about thyroid
Thyroid testing or
And-
thyroid medication?
and medication?
Thyroid, there's definitely thyroid medication on there, absolutely. And so, yeah, I know we've, as I said, anyone who has a list of meds that we wanted to get a pricing for, when I get back from Ireland, I'm happy to go through that with you and try and figure out, what you're going to
Call the contact.
Exactly, yes. Anyone else? No? Thank you all for coming. Feel free to stay for the next presentation. Just one other thing, if you do want to enroll by phone, just leave your name on the enrollment sheet. If you're not on the phone, website, et cetera. I'm here to leave your family.
I bet it is.